Evening, everyone. Thank you. I am Dr. Olivia Kasirye. I'm the Public Health Officer, and I'll start off with just a very brief update on the numbers and an update on where we see ourselves right now. So the numbers reported from this morning, 233,945 cases of COVID-19 reported to Sacramento County. We are averaging about 3,000 new cases per day. And the average case rate is 199 per 100,000. The deaths are 2,607. And we are seeing a little bit of an increase in deaths at this time. Hospitalizations, we're at 588 with 92 in the intensive care unit. So a few points. Unfortunately, we have found ourselves in another surge. At the end of December, the numbers have started going down from the Delta surge, and we thought that we might see a bump from the holidays, but that we would be able to get through it. But then Omicron came up, the Omicron variant came by and has now become the dominant variant in the specimens that are being sequenced. It has resulted in outbreaks in schools and outbreaks in the jails and long-term care facilities and homeless shelters. And we are seeing a record number of new cases every day. A few things to point out is that although we are seeing more breakthrough cases, people that are vaccinated tend to get milder disease. So we still continue to encourage people to get vaccinated, especially get a booster if you're eligible for a booster as well. We also still have a mask mandate in place. I've received a few questions from the public with people challenging why we are still doing that. And I think one clear evidence of the fact that masks, when worn consistently and properly, do work is when you look at the situation in the healthcare facilities where they are required to wear masks all the time and they do fit testing for N95s, is that the cases that we see there are not due to a transmission within the facility. It's actually due to transmission from the community. And otherwise, when they are in the facility, even though they are working on COVID patients, they do not get transmission from that. We also know that from other countries as well, where they consistently use masks, that it has helped with keeping the transmission rates down. So it is still useful, but what we need to realize is that we need to use the different layers of protection. So the safest and most effective that we have is vaccination. The next is wearing a mask when you're out in public. And the other is for people that have symptoms, they need to stay home. And with that, I'll turn it over to Dr. Cohen.
Thank you. So my name is Stuart Cohen. I'm one of the infectious diseases docs over at UC Davis. As I say all the time, I appreciate the opportunity to participate in these sessions. We are struggling these days over in the hospitals. We have the highest number of COVID patients that we've ever had. Now, they're not as sick. They're not in the ICUs. Many of them are coming in for something else, but are testing positive. And the problem, though, is that all those people are potentially transmissible within the hospital. They're contagious to the other patients. And so it requires still isolation and keeping people separated and trying to find places so that we don't put other people who are not infected at risk because the number of patients are there. Our emergency room is really overwhelmed right now. There are patients that sit for hours on ambulances waiting to be unloaded because when the hospital is full, the ER doesn't have people placed to push people when they are admitted. So they sit in the ER while they're waiting for a bed in the hospital. And I suspect we're not different than any of the other hospitals within the area. The other thing that's been a little bit different with this Omicron surge is that we are seeing more healthcare workers infected, large majority outside of the hospital. And I think during the holiday season, it probably did fuel this a little bit. The disease in vaccinated people is pretty mild. There's an occasional patient who doesn't do very well after being fully vaccinated, which, by the way, I define as 3 doses. I hate to sound a little bit different than what's normally said. I don't even call the 3rd dose booster anymore. I think this is a 3-dose vaccine. That's my opinion. I will leave it at that. And I think of our hospitalized patients, 80% are still not vaccinated, right? So it's still, even though Omicron is much more contagious and a lot more people are vaccinated getting infected, the people in the hospital are unvaccinated people. And it still suggests rolling out vaccine and getting things together. And sorry. And so I will just leave it at that. I think we still have to get people vaccinated. Maybe I should mention one other thing. I think we're all hoping this is the last wave. I don't know how to think about this. I'm not a modeler, but we also know that antibodies to coronaviruses don't last for particularly long periods of time. And so until we get people immunized elsewhere in the world, we are potentially at risk for other surges like this. Coronaviruses do not mutate as fast. If this was HIV, I don't even know what we'd be doing, right? It mutates so fast. This mutates slowly, but there's so darn many people infected that even with a slow mutation rate, variants are going to keep popping up as long as people are getting infected at high numbers. And so, and that doesn't mean just in the United States, it means everywhere, because this stuff goes around the world amazingly fast, right? It's too bad flights don't last this short. Anyhow, I'll stop at this point, see who's paging me while we address the initial questions. Thank you.
All righty, thanks, Dr. Cohen. So we have some really great questions coming in through the Q&A. As a reminder, you are most welcome to submit your questions also in language, and we will translate. So we have our first question. Can Sacramento County please consider banning large gatherings or at least mega events to manage the pressure on hospitals and disruptions to access to healthcare for both COVID and other medical concerns?
You know, we've discussed that quite a bit internally. We did use banning of gatherings at the beginning of the pandemic, when the only measures that we had to protect the public were the non-pharmaceutical measures. And but you can only do that for so long. And it gets to a point where, as you saw, people it was difficult to continue in the lockdowns. And so having the vaccine available helps us to be able to start looking at ways of getting back to normal. And that's why our push continues to be vaccinations. We do understand that the concern people have with the high numbers. And believe me, it's caused a lot of sleepless nights for us as well. But as Dr. Cohen said, that for those that are vaccinated, they tend to get mild disease. So it's still mainly the unvaccinated that end up with severe disease and end up on ventilators. So that's why we need to continue to push vaccination.
What data do we have on the under 5-year population, especially under 2-year-olds? Are Omicron cases staying mild for this age group the way they are for vaccinated kids?
I don't know if Dr. Cohen has some numbers on the pediatric cases. I know we've had a few, and I do need to point out that with this surge, we are seeing younger and younger people with COVID. But I'll let Dr. Cohen speak to what he's seeing if he's able to speak to the pediatric population.
I heard all the numbers this morning, but I can't remember them all. It is significantly higher than it's been because there really weren't very many kids in the hospital. It's still a much smaller proportion of the patients that are hospitalized are pediatric patients. It's the best I can say right now.
Thank you. And building off of that question, Sharon is wondering what the age group in Sacramento that has the highest test positivity rate, and is this consistent with the highest unvaccinated group?
You mean the highest case rate? The highest case rate or the highest number of cases is in the age group 18 to 49, and that has remained constant throughout. But just to point out that the older age group in the past have had more severe disease and more deaths. So we'll have to wait and see what happens with Omicron. But even with this latest surge, it's 18 to 49 where we're seeing the highest number of cases.
And the follow-up to that was, is this consistent with the highest unvaccinated age group?
The vaccination actually goes by age. So the most highly vaccinated are the older 80 plus, and then the vaccination goes down from there, and it's lowest in the 5 to 11-year-olds.
We have a community member that's wondering, well, I'll start with, they're saying, I for one am very appreciative and thankful for the help you've provided for our community. Do you face a lot of abuse from the public over your work?
I have to say that I am very appreciative of the support that I've received, both from the public and from the board of supervisors. And yes, we do get the angry phone calls and the angry emails, but we don't focus on that because our job is to protect the public, and that's what we're here to do. So we continue with that.
I tested positive. Oh, sorry. Go ahead, Dr. Cohen.
I don't get. I
rolling through.
No. I must say that I don't at all. Right. I mean, I get into it with patients intermittently when we're talking about why they're not getting vaccinated and things like that. So they may not go away loving me. But for the most part, I think people are appreciative, and at least they have somebody who's willing to talk to them about this stuff too, which I think is an important part of my job, right? Education is part of being a physician, and so even if you don't convince somebody, at least you get them to think a little bit.
Yeah, and I have to agree with that, and also to add that overwhelmingly the comments we get are from people that are appreciative of the the guidance that we're able to provide, and the vaccine, the tests, and the masks. And a lot of people have come forward to volunteer to assist as well. So that helps as well.
I tested positive on January 4th with a PCR test. I've been isolating since. Do I need to get another PCR before releasing myself from quarantine?
So the guidance has changed recently. The CDC reduced the period for isolation. So if you have tested positive, you can test with the antigen test on day 5. The reason we say the antigen test is that the PCR test tends to remain positive for a much longer time because it's more sensitive in picking up particles of the virus. But with the antigen test, you can test at day 5. And if it's negative at that point, you can end isolation. If not, then you continue isolation until day 10. You also need to make sure that your symptoms are improving, especially if you have a fever, that fever is no longer there.
So kind of coming back to what you were talking in the intro, Dr. Cohen, we have 2 community members, JR and Jeffrey, who are wondering about any model predictions of when our county may finally reach low or mild transmission tier as identified by the CDC. Has Sacramento peaked? What other variants beyond Omicron are of concern?
So at least the modeling that I saw from University of Washington suggests that the state of California has peaked, and we should start seeing some decline. It does appear that one of the things that's occurred with this Omicron variant is that while the peak went up fast and is high, it's going to come down faster than with the other variants as well. At least that's what's been seen in South Africa and in England. So I think we are probably right now at or near the top, and we should start seeing some decline occur. Regarding other variants, I guess I've been preoccupied enough with Omicron right now that I haven't really been keeping close track of whether there are others that are floating around in the background. But you remember, as long as the Omicron is around, anything that will have to take its place is going to have to be transmitted more readily or do something different that makes it superior from a survival of the fittest point, right? That's how Omicron overwhelmed the Delta variants. And so I don't know whether there's anything out there right now. I am hoping for, at very least, a respite for a period of time after so many people have been infected before we start seeing other variants. But I'm hopeful that within, when we do this again in a month, that things will be much better.
That's what we're all hoping for.
All right, let's talk about schools. So there is a very technical question here around the school decision forest. So last week, Sac County Public Health sent out an interim decision forest for K-12. They suggested schools could adopt group contact tracing models, which offers an option other than modified or full quarantine. My school wants to adopt this practice. It appears, however, that the decision forest does not seem to factor in group testing within its branches.
Yes, you bring up a good question. When we set out that interim guidance, and if you recall, this time we called it interim, was the schools were opening up and the guidance had not come out from the state yet. We just recently, I think it was end of last week, got the new guidance on the group the kind of contact tracing. So a notification. And so we've had those discussions with the schools, and we will set out new guidance that will include information on how to do that as well. But for schools that want to go ahead with it, they're able to take the information straight from the CDPH website.
What metrics would close the schools for a period of time or trigger testing of all students?
So at this point, we are really prioritizing as much as possible being able to keep the schools open. And I know that the school staff have been looking at innovative ways of being able to do that, using or actually asking for volunteers to come in to be subs for classes, or even merging classes if they don't have enough staff to be able to run the class. But if it gets to the point where they have so few staff that it is unsafe to keep the schools open because of lack of proper supervision, then they can make the decision either to close a classroom or even a school for a short period of time to allow for that recovery to occur so that they can reopen up again as soon as possible. So we, that being able to test the entire school would be ideal if we were able to have enough tests and enough staffing to be able to do it on a weekly basis. But we know that that's very difficult, especially for the larger schools and school districts to be able to manage. So that's why they're still working on being able to identify exposures as quickly as possible and focusing on those for testing.
When can I get 3 free N95 masks at CVS? And how many days can I use the same N95 mask before replacing it for a new one?
So the N95s, that's an offer that is coming from the federal government. It is not going to go through the county. So we will hear about it the same time that you will, and looking forward to being able to provide information about that. We know that now you're actually able to go to the website and request your free tests. So hopefully all of you have done that. As far as the N95s, how long you can use them, I know that there are stricter guidelines in the healthcare setting, but what we have told individuals in the past when they had to use N95s in a non-healthcare setting was generally make sure, because for one, because they are so tight fitting that it's difficult to use them for a very prolonged period. So people, you need to be aware of themselves, and if they're having any difficulty breathing, they need to take a break and be able to, take it off in a safe place for a short period of time. If it gets a lot of moisture, it's probably not working very well. So that's a good indication to take it off and get another one. The other is if it's dirty, that's also an indication that it's not working very well.
Are hospital staff in Sacramento County being required to work if they have tested positive for COVID?
They're not at UCD. We have used the same rules that Dr. Kasirye had just pointed out. So at day 5, we are doing antigen testing for our positive healthcare workers. If they're negative, they can come back to work. If they're positive, we test them again at day 7. And if they're positive again, then we bring them back at day 10, as we have been since the pandemic, pretty close to the beginning of pandemic. So, and the day 5 tests, somewhere around 60% of people have been testing negative at day 5. So still 40% are staying home. And again, this includes, you can't have symptoms, right? That's the thing, right? You can't come to work with symptoms. The people who are really clearing are people who were exposed to somebody and got tested, or had very minor symptoms that went away after a day and got tested, and they cleared. So we are not having actively infected people at work. There was some discussion about that. That's when people get to what's called a crisis standard of care. You just have to have everybody who can work at work, but we have not reached that point, or at least we hadn't, and we have not had infected workers at work. I can't speak for the other facilities in Sacramento.
Yeah, right. And I haven't heard that from any of the other hospitals either.
Can counties provide resources to private businesses to enforce the mask mandate? Many businesses no longer want confrontation, sometimes violent, from the unmasked, so they do not enforce the mandate.
You know, that's been quite a challenge, and I think many of you see the importance of us being in public health, us being able to work with the public, because to a large extent we are dependent on the public following the instructions that we provide. We do not have enough staffing to go to every business to enforce. So it is dependent on the businesses to do the enforcement, and we are aware, very aware of the difficulty that a lot of the businesses have had. It's unfortunate because this is something that is relatively easy to do and is effective and keeps everybody safe. So I wish that people would see it that way, and also realize that this is just for a short period of time, and there will come a time where we won't have to wear the masks, but right now we need to, because we are dealing with a virus that is transmitted through the air. And if you are not going to take measures to protect yourself or others, then you just continue to propagate and give opportunities for this virus to spread.
What about those of us that started with the Johnson & Johnson? Should we get another vaccine when it comes to the booster?
I can start, and I'm sure Dr. Cohen has a lot to say about it also. So yes, we have had a lot of people that had the Johnson & Johnson to begin with, and for the booster, they've been getting either the Pfizer or Moderna. It's a discussion that we have with all the individuals that come. So Dr. Cohen, is there anything else you?
Yeah, so I think there are 2 points. Number one is there was a study that was done that took people who got each of the vaccines. So people who got 1 dose of J&J, 2 doses of Moderna, 2 doses of Pfizer, and then they shifted them around to get one or the other of the vaccines as a booster. So the J&J people got another J&J, or they got a Moderna, or they got a Pfizer, and likewise with all the groups. What it turns out is that you get a better antibody response if you get an mRNA vaccine after you get J&J than getting a second dose of J&J. And I think that's why the CDC has suggested that everybody get another, when they get boosted for their J&J vaccine, that they get that they get an mRNA vaccine, and it's within 2 months, right? So it's almost like just giving a second dose of the vaccine. And the thing that's been, I think, a little bit frustrating to people who are who receive J&J, and that may be part of where this question is coming from, is once you're 6 months out of, or 5 months out of that second dose of vaccine, should you get another dose of vaccine, right? Should you get a third dose? Like if you had received 2 Modernas, excuse me, you would get another Moderna vaccine at 5 months after the second dose. And so I think that's the challenge, is that there really hasn't been guidance given on whether a third dose of vaccine should be given to J&J people. I think a lot of my colleagues within the infectious diseases community think they should get a booster dose at 5 months, but there's no advice on that, and I don't even know whether it would be doable, given the fact that there has been no guidance on that. And again, these are people's opinions. They don't really have data to base it on.
All right. So we have a testing question. I went to the County Branch Center Road test site on Thursday morning, stood in line for 2 hours for a PCR, didn't get the results until 5 days later. What is the current test result time for county sites?
So just to explain a little bit about the process, when the county test sites, we have staff that collect the specimen, and then it is shipped to a state lab in Valencia. Because the state lab in Valencia is servicing a lot of other sites like ours throughout California, as you can imagine at this time, with the record number of people that are seeking tests, there's been a large number of tests that are going to that lab. And so that has created a bit of a backlog. So yes, we are hearing about these delays of 5 days. And our hope is that this will be short-lived and that we will soon be able to get back to the regular 2 days that is expected for this return of these PCR test results.
And I'll just add that most of our community testing sites offer both antigen and PCR. Branch Center is one of the 2 sites that only offers PCR, and that hopefully provides a little bit of support with the turnaround time, is that many of our sites you can get both. All right, so are there any plans to hold vaccination clinics at school sites, specifically for more rural areas where people may not be able to get to a healthcare center to get their child vaccinated? Have district superintendents been responsive to discussions of vaccine clinics?
Absolutely. We work very closely with the superintendents and school principals on setting up clinics. And many of the school districts have actually been able to hold clinics, not just for students, but for staff as well. So, and we also have 2 teams actually of county staff that are going to the different sites. And we also have, I think, 1 or 2 teams from the state that are still doing clinics at school sites.
And how about for the homebound? Does the county still offer mobile vaccine services for homebound individuals?
Yes, we are continuing to do that. And actually, Liz, you might have an update on how that is going.
So I can definitely talk about homeless individuals, but for homebound.
Oh, my mistake. Yep. I know you said homebound, but in my head, I heard homeless. Yes, we do have for the homeless and for the homebound. For the homebound, what they need to do is they can call 211 and request those services. That information will then come to our team and they will be put on a list. And then we have a contract with an ambulance service that goes out to these homes to be able to give the vaccinations. We do ask that these calls are made only if the person is truly homebound, and that you keep your appointment once you make it, because as you can imagine, we have limited resources. So if somebody has an appointment and then doesn't show up, then it puts everything behind, because as you can imagine, they're driving all over the county in order to be able to provide this service.
Do you suggest we get the flu shot and the booster together? And what will help with newborn babies with getting COVID-19 since they can't get the vaccine?
Go ahead, Dr.
Well, no, I was just going to say, it's just easier to get them both, right? There's no reason you can't. And once you're there, you might as well get them both at once and get it done with. So that would be my suggestion. There's no problem doing them both at the same time. And as far as infants, I think it's always been my thought that like when I had a infant son, right, my flu vaccine was what was his prevention, right? Because those little kids, they're not going anywhere. It's the people within the household that are the people who are potentially going to transmit to them. And so the fact their parents and their sibs being vaccinated, that's the protection for the infants. And, if they happen to be born to somebody who's been vaccinated, they're also going to have some antibodies that get transmitted across the placenta and may provide a certain amount of protection as well.
What is the rate of false positives and false negatives for the antigen tests, especially for the tests that the feds will be sending us through the mail?
So the Binax Now test, which is the one that's going through the mail, is probably about 70% sensitive. So the key point, I think, with the antigen test is that, as Dr. Kasirye brought up earlier, they're not as sensitive, but they tell you whether you have a high amount of virus present, and that tells you whether you're likely to be contagious or not, and are a risk to others around you. And so the way that most people suggested using antigen testing for screening, if you're not having symptoms, is doing them daily. Obviously, if you only get 4 tests, you can only do that for 4 days, and then you're done. But I think that once you have symptomatic disease, if you're negative on day 1, if you did it again on day 2, you're probably going to be positive, right? It depends on how high the amount of virus is within your airways. And so I think that's the important point. False positive tests are pretty uncommon. It's probably under 5% false positives, but there are probably somewhere around 30% false negative tests, particularly early on in disease.
So we have a question about Sacramento County Public Health's January 6 order directing all public meetings back to remote only. When other large-scale events can continue to occur with layered mitigation in place, what exactly prompted and drove this decision?
For the public meetings that we don't have, there is no luxury of being able to put into effect the measures that we have for mega events, because public meetings by nature are very open, and so it does make it more difficult to be able to implement some of those measures. So that is, and in looking at ways of being able to take some measures to protect the public as well as protect the staff without affecting the government's ability to do their job. This was one measure that could be taken.
Has Sacramento County considered requiring vaccinations to dining indoors, going into bars, et cetera?
We have considered it. I think the challenge goes back to enforcement because, as I mentioned before, when we issue these orders, we are still dependent on the public to follow those orders. And in this case, it would be incumbent upon the businesses to enforce. And so in looking at it and what it would take to be able to put this in place, because basically the restaurants would have to be able to verify that vaccine card that is presented to them is actually valid. You can do that, but it's easier to, it does take some resources. And at this point, we made the decision that we were not going to go down that road.
So we have a number of questions and concerns about schools. So community member is wondering, has school spread remained low? Is there additional funding for testing at Folsom Cordova Unified School District? Testing days at both the school and community are inundated.
So for the schools received additional testing kits from the Office of Education through the state. And our hope is that we'll be able to get additional testing kits. It's been a bit of a challenge because what the state had told us was that they had put in a lot of orders that would have met the need. But because of the competition with other entities, other states, it became very difficult to get those orders fulfilled. So some of the allocations that they're expecting to give to the schools have still not been filled yet, but hopefully we'll be able to get past that. I hope I answered the question.
You did. And to the community testing question, we've been asking, getting additional staffing to our community sites. We've already seen the wait time go down, and we hope to continue to see that wait time go down throughout next week. So, and there's a couple more community members that have comments about schools. And so I know you mentioned this before, Dr. K, but maybe you can speak a little bit again about why are children still allowed to attend school? It's so scary with the number of students testing positive on a weekly basis.
The best way to protect your children is to make sure that they are vaccinated. We know that these vaccines are effective. The state as a whole has made it a priority to keep the schools open. So we are doing everything that we can in terms of being able to assist with testing resources to ensure that the schools are able to remain open.
All right, and I just want to note, many times folks ask a long question or have a lot of comments in their text due to the number of questions that are coming in and our desire to get to as many questions as possible. I don't read the full question at times, summarize to get to the points that we're looking for. So it is not an attempt to censor you in any way, but attempt to get to as many questions as possible. So appreciate your understanding. So can pediatric hospitalization and ICU data be published, especially by general age group?
We do get updates from time to time, but we do not have it on our dashboard because we don't get it as regularly as we get the hospital updates. As far as the information that I gave today, the last report that we got, we have 22 pediatric cases in the hospital. I don't know how many of those might be in the intensive care unit. I have to go back and check.
All right. Can you please advise how accurate the home tests are that are being made available for free by the government?
I think that's what we mentioned before. It's about 70%. So, so if you have symptoms and you do it, test again the next day. If it's negative and you still have symptoms, because it requires about 10,000 virus particles on that swab to be able to click positive. So that requires the virus to grow a certain amount. And so it may be sometimes you may be a little bit early, but it's pretty good. And as I mentioned before, a lot of the antigen tests, or maybe it was to some other group, a lot of the antigen tests target pieces of the virus that are not the spike protein, right? So they're not the ones that change so much that the tests become not as effective as these variants modify. I believe the Binax Now test, which is the one that's being distributed, I think targets what's called the nucleocapsid protein, which does not mutate as much as the spike, which is what we target with our vaccines.
Is it possible to get COVID by sitting in a patient's chair at my medical doctor's office or my dentist's office?
I would say no. Right. I think I think, you know, at the beginning we were really nervous about surfaces and surfaces transmitting, and right, people were wiping down their groceries and all that stuff. And I think what's pretty clear is that this is transmitted very, very inefficiently by contact, and very, very efficiently by respiratory. So I think if somebody who had COVID is sitting in a chair before you, you're not going to get it from that chair.
What about people who can't get vaccinated? There are people with illnesses that only received one shot with medical exemptions. What are we doing to protect them?
Yeah, so this is an area that is still evolving a little bit. So first off, part of the way that we protect them is we act like a society, and the people who can be vaccinated are vaccinated, so that we protect the vulnerable within our populations. But depending on the reason why people have not received vaccine, or people who have not responded to vaccine, for example, somebody who has got chronic leukemia may not respond to the vaccine even if they've gotten multiple doses. There is now a long-acting combination monoclonal antibody. The technical names are tixagevimab and silgabimab. It's also called EvaShield. Other people know it as the AstraZeneca monoclonal. It lasts for about 6 months. We are starting to get doses distributed through the health department, and we are starting to give it to our high-risk people who can't get vaccine, or who are unlikely to develop a response to vaccine. And that's a way of giving them what we call passive immunity, as opposed to the active immunity that you get when you get vaccinated. And there's still some logistics to get to really get this ball rolling, but I have been pushing so hard to get this moving. I can't tell you how much I'm irritating people to get this done with and get people shots. And I think these are shots in the arm. I don't think that these are shots in the hindquarters, as they say, as some of the other injections are.
All right, could you reiterate the mask mandate? Is it inside masking only, in public places? Should we be upgrading to N95 and KN95 in those spaces?
So the mandate that the state has is for indoor masking, whether you are vaccinated or not vaccinated. And of course, this is in public places, especially in gatherings. Recently, the CDC did issue some guidance in light of how transmissible the Omicron variant is, that people should upgrade to KN95 or N95. But surgical masks still work. A lot of us are still using surgical masks.
Yeah, I think there are a couple interesting things though. So when we use N95s in the hospital, we get fit tested. So somebody that looks like me can't get a fit because I have a beard, and I would need to use a different device if I was going into a room where there were aerosol generating procedures occurring. But N95s in and of themselves make a little bit of a tighter seal, even for somebody like me, than a surgical mask, and may decrease transmission that way. They also have a little bit of an electrostatic charge on the mask itself that helps helps things attach to the mask and not necessarily go through. So there's actually really is a benefit, I think, to wearing them. The downside obviously has been brought up earlier, that it's hard to wear them for long periods of time because it's uncomfortable breathing. But I think when you're in high risk places, I think it's a good idea to be wearing an N95. And in most lower risk environments, I think surgical masks are fine. I've one of each sitting on my desk. You can't see them because the way these backgrounds work, you can't tell. But so depending on where I'm going, I can use one or the other.
All right, good to have options. So I saw on the news that Marshall Hospital is being considered as a COVID hospital. Is this true? If so, how does this work?
Okay, it's not being considered a COVID hospital. What is happening is that because of the increase in hospitalized cases, the state has been working with regional hospitals to increase their surge capacity. So Marshall Hospital is one of those. UC Davis actually is in the process as well. And we have some other hospitals within Sacramento County that are in that process. And the goal is just to increase the number of beds that are available in the region so that the hospitals are able to take care of all the patients that need the care.
All right, we have a couple questions about teleworking. Folks are wondering if their workplaces should prioritize teleworking and not being in the office for the next couple weeks.
So right now, that is a recommendation that we put forward, but workplaces do need to look at their business need in order to make that decision.
Okay, if I test positive at home, should I be notifying the county of my test?
So if you are using one of the at-home kits, I think the most important is to make sure that you notify your workplace, so that one, you can get access to the appropriate assistance, and get the time off that you need. Usually it's the workplaces that do the notification to the county if there's more than 3 cases. And also definitely if there's a large outbreak, the county gets involved.
I would also note that the iHealth kits that maybe some folks got at the libraries or will be getting have a registration process you can go through. And we recommend that you do it. So that way it is registered in the system and goes to CDPH in the county automatically. So thank you for considering doing that registration process as a part of the at-home kit. Okay,
Can I make one quick comment too, which has nothing to do with reporting, but I think that if you test positive at home and you happen to be a high-risk person that may progress to get more serious disease, it's important to talk to your healthcare provider, because there are therapeutic options now, besides injectable medications like a different monoclonal antibody, or there are pills now too that are somewhat limited in their availability, but they're out there. And so for high-risk people, if you are, for example, somebody in your 70s or 80s and you turn up positive, or you have poorly controlled diabetes, or you're immunosuppressed, tell somebody, because there are ways to keep you from getting sicker with therapeutic options. And I didn't see anything in the Q&A to address these treatments. So I thought this was a good place to stick it in, and remind people that there are therapeutic options now. It's better than it was.
Yeah, thank you for mentioning that.
I am a Medical Reserve Corps volunteer. Thank you for your service, and have noticed that we are no longer being solicited or used for vaccine clinics. Is there no longer a need for volunteers?
I'd like to repeat what Liz said. Thank you for your service. We have been heavily dependent on our volunteers to help us with the different areas, the testing sites and the vaccination sites. So one of the things that has happened over especially at the end of the year, is we did do some transition in terms of reducing the number of pop-up clinics that we were setting up in the community. There are some other agencies that are still doing pop-up clinics. The state is doing a few, and UC Davis is doing a few, but by and large, we just have mainly 2 teams that are going out to do these vaccinations. So maybe that's the reason why you may not have received a request. But if you're still available, there are still other opportunities to assist us. So I'd encourage you to check in with your coordinator and look at the other options that are available. Thank you.
Okay, here's the second part of that homebound question that we were getting into, Dr. K, around the homeless. So I have heard homeless encampments have been hit by this variant. What resources do you have for persons experiencing homelessness? Do you want me to answer that?
Yes.
So we work with our sheltered and unsheltered partners to make sure that there is access to COVID testing, COVID vaccines, prevention resources. So for our shelter partners, we were just on a call with them today to provide the updated guidance for isolation and quarantine, as well as talk about COVID testing. There is also the opportunity to refer into Project Room Key, which is the motel program run by the Department of Human Assistance. although that is at capacity right now. And then we work with the unsheltered partners in homeless camps to provide access to COVID testing, do vaccination pop-ups, and provide outreach materials. So there's always more to be done in this area, because we know that unfortunately there are many people that live outside here in Sacramento County, but there is some good work being done with the COVID response. Okay, so let's see. The next question, should we anticipate a fourth dose, as we've heard is being administered in other countries? Or should we expect a new formula to come out, as Pfizer and Moderna have both mentioned?
So I think, again, a lot of times the data we hear are through newspaper articles or press releases, and we don't get a chance to look at all the information by the time the general public has heard about it. So I'm going to just speak to what I understand about the doses in Israel. And they did roll out a large group of people getting fourth doses of vaccine. What they saw was that the antibodies concentrations in the blood go up, but the protection didn't seem to be much better. They're still talking about potentially offering up fourth doses to highest risk people. And that still is an open question, but it doesn't seem like it provides a super benefit. As far as the variant vaccine, so I know that at least at UCD, there's already going to be some rollout of an Omicron vaccine study in a small number of people, right? With these variant vaccines, don't have to do the giant clinical trials that they did to get the vaccines through initially. I'm sure Moderna's doing the same thing. And so, so it may make a little bit of a difference since the variants change. You sort of feel like maybe when they modify the vaccine, if they'd rolled out a Delta variant, that's already gone now. And so I think that how to really optimize vaccine is still not clear. The one thing I think that, again, is really important to point out, the majority of people who are sick in the hospital are not vaccinated. Vaccines may not provide what we had hoped, which is what we call sterilizing immunity, meaning people don't get infected, but it does prevent serious illness. And so I think when you start talking about doing more and more doses, you have to be able to provide something besides that, because we're already getting that with the 3 doses that we have.
What is the difference between an N95 and a KN95?
I believe it's OSHA certification and more close testing to define what they are. I think materials and otherwise are not different, but the KN95s are not quote unquote medical grade because they haven't been cleared by OSHA.
Correct. And so the KN95s have an emergency use authorization.
And how about the store-bought fabric masks? Should we just not use those?
What some people are doing right now actually is using a combination of the surgical mask and the cloth mask. Definitely each type of mask provides a certain level of protection. The cloth mask is better than nothing. But at this time with the high transmission, especially as Dr. Cohen mentioned, if you are in a high risk environment, such as in a hospital, that you should use the N95. That gives the best protection.
I think the cloth mask sometimes can play a role with the surgical mask in trying to actually cut some of the gaps that the surgical masks have, right? So it can tighten the surgical mask to your face. And right, and a lot of people like the cloth masks because they have cute designs and all that other stuff, which you can still use as long as there's a surgical mask underneath.
Okay, so I'm gonna ask one question. Dr. Cohen, I'm gonna message you another question because I don't know how to pronounce one of the words in it, and I feel like you will. So we'll ask that one next. So the next question. I have a relative sick with COVID since last week. She says her doctor gave her an appointment to come and get an IV of Remdesavir. What is this, and does it treat COVID?
Yeah, so Remdesavir is a drug that stops the replication of the SARS-CoV-2, the virus that causes COVID-19. And the initial clinical trials were all done in sick patients in the hospital. And what the study showed was that it probably didn't have a significant impact on mortality rate, but it definitely had an impact on how quickly people were cleared from the hospital. And it also seemed like it worked better when people were earlier in their illness, because the illness has sort of two phases. One is where the virus is multiplying a lot, and then the second is sort of triggered by our own host response trying to get rid of the virus. There was a study that was published about a month ago in the New England Journal of Medicine that looked at 3 doses of Remdesavir in outpatients and whether that would prevent progression of disease for people to either be hospitalized or have more serious illness than even that. And it turns out that those 3 doses about 89% effective in preventing people from moving forward. So it does work. It's an IV. You have to take it 3 days in a row. I think it's one of the options. It's probably the least convenient of the options, but it works well and it's well tolerated. We are offering that as an option at one of our infusion clinics where we're giving treatment for COVID-19.
And then Dr. Cohen, if you could go to the next question.
Yeah,
Thank you.
So if a person has chronic low-level thrombocytopenia, meaning they have low amounts of platelets from chemotherapy or remote chemotherapy, should they take a vaccine? Is there a difference between J&J and the mRNA vaccines in causing thrombocytopenia? So the answer is yes, they should get vaccinated. And the J&J vaccine does have a higher risk for thrombocytopenia, and therefore the mRNA vaccines should be the choice. And to be honest, I think at this point, now that the mRNA vaccines are well available to anybody, I think that should be your choice, period. I think they're better vaccines, they work better, and I just, I know people like only getting 1 shot instead of 2, but you still end up needing a second shot because you have to get an mRNA vaccine 2 months later anyhow. So just get an mRNA vaccine. It's probably safer in the circumstance of thrombocytopenia, but for everybody, it's just better.
Dr. Kasirye said our death rate has increased, even though Omicron isn't showing severe disease. So are the increased deaths from those that had the Delta variant? And are these increased deaths mostly unvaccinated?
Yes, most of the deaths are from people that are not vaccinated because of the course of the disease and how long it takes to get to the point of actually someone dying from COVID-19. We expect that the deaths that we're seeing right now, most of them are still from the Delta variant. It's only recently that the Omicron became the predominant variant. I do have to point out, though, that even though we do say that the Omicron variant tends to be milder, it does not mean that it's mild for everybody, because there are still a lot of people, especially people that are not vaccinated, that get severe disease even with Omicron. So that's why it's very important to continue with the message of being vaccinated.
We have a couple of just comments here. Thank you for helping us keep our schools open. I know the virus is scary for some, but our children suffered socially and emotionally during the closures. For the immunosuppressed community, thank you, Dr. Cohen. All right, and let's see, Dr. Cohen, I saw that okay, so you typed an answer to that, which is great. We'll take one more question and then we will close out. Dr. K and Dr. Cohen will provide some closing remarks. And then I will put an email address in the chat that'll chat out to everybody if you would like to follow up with our COVID-19 vaccine email and ask any questions that were not answered. Okay, so here we go. Dr. Kasirye, COVID has been the target of hard work for almost 2 years. Sometimes it seems that public health measures other than vaccination have had little impact on what actually happens. In hindsight, what works and what doesn't?
So you are right that because we've put a lot of our efforts in fighting the virus, that some of our staff have been diverted from dealing with other public health issues to deal with this. So in terms of saying what works and what doesn't, I would say in general that communication is very important, and being able to work with the community is also very important. As we have seen, we may issue orders, but we are still dependent on the public to understand those orders and to carry out those orders in order to protect the community. I think it's very important to be able to provide accurate information. One of the biggest problems that we have had to deal with during this pandemic is the misinformation that is spread, especially on social media. So I think my request to folks, I don't know what their motivation is for putting out that information on TikTok and Snapchat and Instagram, but I think they need to realize that there are lives behind the numbers that we provide. A number of people have ended up with very severe disease and complications and death. And so it's not about getting more clicks. It's about being able to give accurate information. And so it's really important for us to give accurate information and be able to save as many lives as possible so that we can get through this.
Thank you, Dr. K. So in closing, why don't we hear from Dr. Cohen on any closing remarks, and then Dr. K, if there's anything else that you'd like to add. I know the last question was sort of like closing remarks in some regard. And then really appreciate everybody joining and apologize that we weren't able to get to all of the questions. I noted that in the comments. We did have a significant number of people attend tonight. Okay, Dr. Cohen.
Yeah, so I've been trying to answer some of these questions by typing them, but I clicked on one instead of typing my answer, I said answer live. So I'm going to be really quick. PCRs stay positive for a really long time. So you don't need a negative PCR to go back to work. If you want to test with antigen. Now I feel better. So, so I think, you know, this has been a really challenging spike this time through, maybe a little bit more challenging than the other ones because of the volume of patients and the relatively ease to get infected. And so we just keep reminding people to be vigilant and try to be safe. It's a long time to try to keep saying this is going to end soon and you won't have to do all this stuff, because we've been saying this for months and months and months on end. So we really appreciate the fact that people are still on board for the most part and trying to do the right thing. And that's why I love participating in these sessions, because I think we see that people are really engaged and really interested in trying to do the right thing. So I thank everybody for their participation. I'm hoping again, by the time we meet again next month, we'll be smiling a lot more than we are right now.
And ditto to what Dr. Cohen said, and I'd like to put in one last pitch. Our hospitals are full, our EDs are full. So our request, our plea to you is that you reserve the 911 call and the ambulance and the ED for only emergencies that require having to go to the emergency room. If all you're looking for is a test, please go to one of the other test sites. If you have mild symptoms, please stay home. But thank you again for listening. And like Dr. Cohen said, we hope that when we have this call the next time, that our numbers will look a lot brighter.
Thank you. These sessions are recorded and will be posted on the Public Health YouTube page after. The Public Health forums are on a monthly cadence, so we will see you again in a month, but we posted some information, resources of web pages to stay up to date on all things public health and all things COVID. And finally, a big thank you to our interpreters who are making this accessible to all of our community members out there. So, alrighty, thanks everybody.
Thank you.